Health visitors have got a breadth of experience, from general nursing to more specific public health, and those specific public health skills you pick up in your training, followed by experience. So they're well placed to understand the policy context and to influence policies that keep people safe from harm and healthy, but they also understand how individuals respond to that. I think what health visitors are good at, they understand the individual sensitivities of communities. So what works in one community doesn't necessarily work in another. So they can moderate their interventions and their interactions accordingly. What inspired me to train as a health visitor? It was an interesting journey really, because I spent most of my early years in the acute setting, i.e. nursing in a hospital. And it was that really inspired me to exploring further relationships with individuals, not just the relationship at the point where they were critically ill and very dependent on me, but at another point in their lives where they were sort of starting off and in the context of their own families and their own environments and their own communities really. And it was that interest in terms of what impact that has on health and well-being that inspired me to go into another role. I did quite a lot of work with young mothers, travelling families, etc. And then I charted my way through various management and leadership roles, and the experience of health visiting was vital in helping me do that, because I went into those management and leadership roles really understanding and looking for the big picture. There are sections in Greater Manchester where over 40% of our children are living in poverty, and that's going to get worse actually. We're going to have more children in that trap rather than less as the economic climate gets worse. So the promotion of health visiting is really important, because it's health visitors on the front line that really spot the health impact of poverty as it's happening. It's the health visitors who are really skilled at developing interventions to combat that. Health visiting's a really important part of the NHS and social care professional family, and I think that role's going to grow in importance, and I think health visitors should be proud of the investment that's going to be made over the next 5 years. And health visiting is really well placed to have a general role in the health and wellbeing of the population by providing universal services, but also that targeted role that they have in really seeking out our most vulnerable clients and members of the public and offering a targeted service to support people to have a good start in life.